Hello, in this video we will discuss several assessment methods that are used to measure muscular strength. The assessments are a 1 rep max bench press, a 1 rep max squat, and also a maximum push-up assessment. The level of muscular strength will be categorized according to the ACSM normative values and using strength to weight ratio. The equipment needed for assessing muscular strength is a bench and an Olympic barbell. Now I will discuss the 1RM assessment for bench press and the squat. Before determining the 1 rep max, the subject should warm up by a 5 to 10 minute low intensity aerobic exercise or by completing a number of submaximal repetitions specific to the exercise. A 1RM is the heaviest weight lifted successfully through the full ROM with no assistance and using proper technique. The initial weight of the assessment should be 50 to 70% of the perceived maximum weight. Continue increasing the weight by 2.5 or 20 kilos or 5.5 45 pounds until the lift cannot be achieved. The 1RM should be reached within 4 sets with rest periods of 3 to 5 minutes between trials. The final weight lifted successfully will be measured as a 1RM. Following the determination of the 1RM bench press, the strength to weight ratio will be calculated and the correct classification will be determined. The strength to weight ratio is a cohesion of the 1RM weight pushed in pounds and the body weight in pounds. Now I will be explaining reps to fatigue. Reps to fatigue is when a person is able to perform 10 reps with about 75% of their 1RM max. Maximal is when a person does as many repetitions as they can, while submaximal, on the other hand, is a relationship between the number of reps to fatigue and the percentage of maximum load, which is 2 to 10 reps, and this is used best for sedentary adolescents and older populations. Push-up assessment. The push-up assessment is administered with men starting in the standard down position, hands pointing forward and under the shoulder, back straight, head up, using the toes as a pivotal point, and women in the modified knee push-up position, legs together, lower leg in contact with mat, with ankles plantar flexed, back straight, hands shoulder width apart, head up, using the knees as a pivotal point. The patient must raise the body by strengthening the elbows and return to the down position until the chin touches the mat. The stomach should not touch the mat. For both men and women, the subject's back must be straight at all times, and the subject must push up to a straight arm position. The maximum number of push-ups performed consecutively without rest is counted as a score. The test is stopped when the client strains forcibly or unable to maintain the appropriate technique within 2 repetitions.